manifesto today, something for everyone, tears, laughter, and a little bit of politics. And as far as I'm concerned, it's got a good message. It's easy to read, it looks quite nice, and I hope that when it hits the streets of Medway, we'll find that it goes down very, very well indeed. So, for my bit of it, here we go, health. Health's had a very high profile under my watch as spokesperson. Sadly, often for absolutely the wrong reasons. Tories in government and locally are living a lie. They haven't protected our much-loved NHS. Actually, they've starved it of funding by giving it a standstill budget at a time when demand is rising. And that amounts to cuts, relentless and year on year. They've led a wasteful top-down reorganisation that, by the way, was never mentioned on any election leaflet I saw in 2010. And now the facts speak for themselves. Many hospital trusts are struggling financially and are short-staffed as a result, and our local hospital, Medway Maritime Trust, has had a very rough time indeed. Our hospital has persistently been unable to meet national standards for A&E waiting times. No wonder. When staff are working in an environment that needs modernisation and is too small to cope efficiently with the 2,000 patients who turn up there every week to be treated. The hospital still has high deference because the health of our local population is poor, especially compared to the rest of the South East. There can't be many towns where if you get on a bus from Raymond to Chatham, your life expectancy goes down by 9 years. But that happens here, and that's a fact. The Tories have slashed social care budgets too. They've taken 2.5 million nationally from social care, making it more difficult for frail elderly people to get free home care. So they arrive at hospital in a worse state than before, stay longer, and then struggle to return home because the complex care packages they need are not easily available. Beds for mental health patients have been reduced, and community mental health services have suffered cuts too, and the fallout from that brings more people to the hospital. Take that all together, and you start to understand why report after inspection after report found Medway Maritime wanting. And each time that happens, the hard-working staff there are bashed again, demoralised by another post-inspection action plan. I think they've got 13. Unstable management and risible wage increases. The local Tories have sat on their hands, shameful, ashamed of what's happening, except for when they get a chance in council committee to criticise the hospital, then they have a whale of a time. Coming out and criticising the management, saying the staff are not working hard enough, criticising people for actually going to the hospital, and all the time encircled, locked into an ideology that wants to privatise the NHS. What about the local Liberals? What have they done? As Ed Miliband said this week, locked in the boot of the car of the Tories. They've sat on their hands too. How about UKIP? Nigel Farage wants to privatise the NHS. He's been quite clear about it. It was in his last manifesto. Our NHS is in danger, and nationally, locally, we're the ones who can save it. So what would we do? What would a Labour Medway do about health? We'd continue to support the hospital, just as we've been doing, but this time by strengthening local services to take the pressure off. We'll campaign for a minor injuries unit, just as our Medway survey suggested we should do. We'll work with partners to restore, health partners to restore GP walk-in centre hours and keep people out of A&E. Make sure that social care services can cope with elderly patients who are discharged from hospital, because we develop the sort of care packages they need and have them waiting ready for them when they get home. The council is responsible for public health, yet it's already starting to slash those budgets too. We bring back the health and lifestyle trainers who worked in the community out of the Sunlight Centre to help their clients make lasting changes to their lives. We'd give greater access to public health facilities, and by doing so, make good health a right for the many instead of a luxury for the few. Our Carers Charter will show how much we value the 7,000 people, mainly unpaid, who care for elderly and disabled people at home. and make sure their needs are met too, because they need help to stay healthy and get some time to themselves. And we'd work with health employers and unions to give frontline workers the training and resilience they need to do a good job. I'm hugely proud of the NHS, beleaguered, battered, starved of cash, encircled by Tory hedge fund sharks who are waiting to privatise it if they get in again next time. So much so, they didn't even give it a mention in this week's budget. The NHS still defines the best of Britain, the best of Medway, shining legacy of that audacious 1945 government who built it when they were bankrupt. Never mind about austerity, they were bankrupt after a world war. Austerity is not forever. We can and will do better. The Labour Medway could make the difference because our policies join up. Decent housing, education and a thriving economy all contribute to maintaining good health. Together we can make it happen.